Doctor, how
Good morning.
concerned should we be about this new strain in Australia?
Well, at the moment, it doesn't appear to have been significant in Australia, but I think on a world terms, it is reasonable to be concerned. It is in use. It does appear to be different, although there is some controversy as to whether it is actually more infectious. But the concerns about the rapidity of the spread in Kent in the UK are reasonable because it's just taken over there from somewhere in the border about 25% up to 60% of the cases in that area very quickly over a month. But also because of the number of mutations on this strain and the possibility that two of the mutations may either be affecting potentially the infectivity of it, but also the potential that there is a possibility that it is affecting one of the strains that affects the possibility of making it potentially even a little bit more serious.
Yesterday in New South Wales, we saw 15 new cases out of 38,000 tests. Is this a cautiously optimistic sign?
I think that is one of the good bits of news, along with the fact that, there is good contact tracing, the QR codes are positive, and the fact that everything does seem to be linked at the moment. But I think whatever the case is, it is reasonable still to say that, New South Wales is cutting this fine and they are dodging bullets at the moment, because the bottom line is that despite that, you still don't have the source. And the possibility is that there may be, unchecked propagating chains of infection out there that we don't know about, but hopefully will get picked up as soon as possible by the testing. But there is still significant worries about what's going on there, and I think we're just hanging on by grim death for Christmas at the moment.
Yeah, you said New South Wales is cutting it fine, and of course the Premier faces that critical decision tomorrow whether to extend the Northern Beaches lockdown. Given that there are now more venues being listed in the Northern Beaches as well as Greater Sydney, realistically, what are the chances of the case numbers slowing down before Christmas?
Well, I don't know. I mean, they've said got more data, but I think it's right on the edge at the moment with the increasing number of cases up there. It would only take one of those to become a bit more of a super spreader and then leading it on, and then it gets out of hand. I mean, look, I think the level of concern is actually reflected by the actions of the other states in terms of closing up their borders, because they're looking at this and getting quite worried. And I think it is very much on edge, and they are dodging bullets at the moment. And it wouldn't take much to tip it right over to either a continuation of the lockdown in the Northern Beaches, but also a potential lockdown further across Greater Sydney.
There has been a lot of questions about whether masks should be made mandatory during this outbreak. Do you think that would be appropriate as another line of defence?
Yeah, I think the issue is that the government there is actually trying to gauge the sentiment about the most effective way to do this and whether they can keep the community with them. The bottom line is everybody should be wearing a mask. It's just as simple as that. Wear a mask. Now, the thing is whether you want to make it law or not is another question. And I think that's the trick of governments at the moment, trying to work out whether they can bring along their community and get the best bang for buck in terms of everybody coming along with them in their decisions. So, I think that's the thing they're gauging, especially coming into Christmas, which is, I think the bottom line is that Christmas is, making the decision such a difficult one, because they realise the enormity of, making either continuing the restrictions or making even the restrictions greater, which I think is very, very much on the cards if they still start seeing more cases, if they see cases popping up, particularly if they can't link them back. That's when they've got a real problem. So we'll have to see over the next couple of days.
Doctor, the vaccine rollout isn't due until next year. Given the situation in Sydney, should we be looking at bringing that rollout forward?
Look, I don't think there's enough of a material change in the situation. Where we are at the moment, we're in an uncertain, holding our breath situation. Hopefully the tide can be turned in New South Wales. Now, if it doesn't and it gets completely out of control, like it is in other countries, well, that may change the decision. But I think we would be much better placed to go through our normal regulatory processes and then do this in the orderly way that has been planned. So I don't think at this moment there's enough of material change, because I think, as I said, they're cutting it close, but let's be optimistic and hope that they can turn the tide just before Christmas for us.